Good afternoon, everyone, and welcome to today's presentation. Apologies, first of all, for being a few minutes late. Our webinar today is part of our Collegiate Recovery webinar series. My name is Olivia Pinelli, and I'll be your host today. We're joined by Dharma Mirza and ARHE's Justice and Equity Fellow, and we're also accompanied by Sylvia, who is a fellow of ours too. The topic of today's presentation is including trans and gender non-conforming communities in collegiate recovery. These webinars are hosted by the Association of Recovery in Higher Education in order to support the growth and development of the collegiate recovery field. Just a few reminders and logistic items before we turn things over to Dharma. Today's webinar will be recorded and uploaded to YouTube and the ARHE website. You can go back and access all that information at a later date. If you have any questions for our presenter, please enter them in the Q&A box at the bottom of the screen, and we'll get to as many questions as we can. Supplemental materials provided from the presenter, such as slides, can be sent out if you would like that after the presentation. If you're experiencing any technical difficulties or have any logistical questions, feel free to message us through the chat box and direct the message to all panelists. We're always looking for ways to improve, topics to cover, and any other feedback from our attendees. So if you do have any, reach out. You can either put a comment in the box or you can reach out to us afterwards. Now, before I turn things over to Dharma, I would like to read a bio. Dharma attends Oregon State University, studying public health, queer studies, and medical humanities. Dharma focuses her work and research on harm reduction, sexual health, addiction, public health equity, and the intersections of behavioral health and marginalized health populations. Dharma informs her work through intersectional, feminist, and decolonial frameworks and draws on her own experiences in navigating health harm reduction services as an HIV-positive, queer, biracial, transgender woman. Karaji Sira and former, which means Pakistani third gender, and former sexual health worker and IV drug user. Thank you for joining us today, Dharma, and I'm going to turn things over to you.
Thank you, Liv and Sylvia, for having me today. And I'm really excited to be here. As Liv pointed out, this is the webinar for including trans and gender non-conforming communities in collegiate recovery. I do have my live captions going, and they're not 100% accurate. I'll try to, if folks need a different copy with different captions, I can provide those after. As well. But yeah, I'm the 2021 ARHE Justice and Equity Fellow. I'm here at Oregon State University, where I'm part of our collegiate recovery community at the Joan and Tom Scoro Collegiate Recovery Community. I am queer and gender fluid, and I do identify as a trans woman and a Collegiate, Pakistani third gender. My pronouns are she, her, hers. In the bio, I had some of my stuff, but I'm a health researcher. I'm a community health educator, really focused on harm reduction and HIV/AIDS prevention, as well as social justice advocacy. So today I want to talk about things from my own experience as a trans person, navigating recovery spaces, but also as someone who is also really just invested in recovery communities and health promotion as well. So first off, I want to kind of just dive in and talk. And before I get started too, I want to let folks know I'm really interactive. If you have questions, feel free to drop questions at any time in the Q&A. I definitely want this to feel like a discussion as much as possible and to answer questions. So even if you feel like I haven't gotten to something yet and you have a question, feel free to bring it up in the chat, and I'll try to get to that too. So the first thing is that I use these terms trans and gender non-conforming, and I wanted to really get at maybe why it's important to center these kinds of issues in collegiate recovery. Well, first off, trans and gender non-conforming students are at higher risk of addiction compared to cisgender peers. We're also less likely to be able to access inclusive or culturally competent recovery services. So this is true for the wider community and on campus. Transgender folks and trans folks have historically been excluded from uh, just general healthcare, right? Not even trans-related healthcare, but general healthcare, due to transphobia and gender discrimination. And this is no different on college campuses. Trans and gender nonconforming students are less likely to be able to access services, even if they are available at campuses. Higher education itself historically also excludes trans and gender nonconforming students. We know that the institutions of higher education themselves have been exclusionary and continue to be exclusionary in many ways. We also know that collegiate recovery programs are they predominantly center white, male, cisgender, and heterosexual students. Um, and and it's also important to understand here in regards to students that trans and gender nonconforming students are more likely to be self-supporting and or to have disparate relationships with their families. So the reason why I bring that all up is to kind of bring into this conversation that there are some systems of oppression at play in the lives of trans and gender nonconforming students that maybe intersect with or are like constellating with their recovery. And it's really important that we understand that maybe the things that push trans and gender nonconforming students into recovery are not solely based on personal decisions, but that they're also related to systemic factors that push trans and gender nonconforming students into higher rates of substance use and chemical dependency. So the term itself, trans and gender nonconforming, are not wholly inclusive terms. They're terms that I use, and they're terms that I've learned to use from other activists, other educators, and other trans folks, but they're definitely not perfect terms. So I use trans and gender nonconforming as an umbrella term to refer to communities whose gender identities do not match their sex assigned at birth. Oh, sorry about that. This includes, but is not limited to, identities such as transgender, genderqueer, non-binary, third gender, two-spirit. And for folks that don't know what that term means, that's um, an indigenous gender diverse category that could include maybe what we think of as trans, but is a distinct category of a gendered ethnic group, agender, and other communities. I thought it was also helpful to maybe define for folks this term cisgender, which just means that your gender identity matches the sex that you were assigned at birth. There's a couple of key points here that I want to make as far as terminologies. The first off is to let individuals and communities define themselves. I've learned that even as a trans person, I don't necessarily know all of the nuances of people's identities. And so the best thing is to not make assumptions, the third point there, and let communities and individuals define themselves. Understanding that gender is something that is culturally defined and often defined without the consent of individuals. It's even more important that we be reflexive to the fact that no term is going to perfectly describe the trans community. And then also just understanding that this underlying premise that gender and sex are spectrums and not a binary is really important in understanding how we talk about and categorize trans and gender nonconforming students. So I don't want to spend too much time talking about the entanglement of these four ideas, but I do think that it's important to note that in conversations around LGBTQ plus students, they're often viewed as kind of a homogenous group, that we're all the same. And this is because of a lot of conflation of these four ideas and other things as well. This is definitely not comprehensive, but the first is sex. Your sex is your physical sex characteristics. That includes like your hormones, your secondary sex characteristics, things that we would attribute to the body. And then there's your gender, which is your sense of self, your sense of gendered self, or lack of a feeling of gender. Then there's your gender expression, which is how you express your gender, which we know is not necessarily related to your gender or sex. An example, a really basic example is maybe just the idea of a tomboy, of a cisgender woman who acts ways that are that we might perceive as traditionally masculine, just for instance. And then there's another thing, which is sexuality. So that includes your patterns of attraction or lack of patterns of attraction towards people. And those definitions were all really quick, but the main thing is that your sex, your gender, your sexuality, your gender expression, and maybe even your sexual action, your gendered action, what you do, these things are all different than maybe how you identify. And so it's important to not think of LGBTQ plus students as homogenous, as having the same issues, and maybe specifically understanding that transgender students are a specifically marginalized group within the LGBTQ plus community. In spaces of recovery, as well as wider LGBTQ plus spaces, trans and gender nonconforming folks have often been scapegoats for further marginalization, for the furthering of LGBTQ plus rights, while excluding trans folks. So it's important to recognize that there is some disparate histories in the inclusion of trans people in the wider LGBTQ plus community, and that's just an important consideration. Does anybody have any questions on just that kind of those kinds of definitions or things? Okay. So the first thing I wanted to talk about is maybe an opportunity for inclusion that comes up right away when a lot of us think about trans and gender nonconforming students, and these are concepts of misgendering and dead naming. So to misgender somebody is basically to just refer to an individual as a gender other than what they identify with. This includes referring to someone as a gender or sex other than how they identify, or using pronouns that an individual does not use. For instance, that would be calling a trans woman a man, or using he, him pronouns for myself. Dead naming is a process where someone uses someone's birth name or legal name or name they otherwise do not use or no longer use. And the thing about dead naming and misgendering too is that these aren't necessarily intentional. You don't have to intentionally be trying to misgender someone to do so. You don't have to be intentionally trying to dead name someone to do so. The fact of the matter is that when you use gendered terms, pronouns, or names that an individual does not use, that you're not respecting that individual's identity. The most important thing about pronouns and names, along with how we think about what we would call trans and gender nonconforming communities, is that they should be respected and self-defined. Just because an individual identifies a certain way doesn't mean that they use a certain kind of pronouns. And understanding too that these aren't necessarily things that are only things that trans and gender nonconforming students ask. Lots of people change their names at various points in their lives. People get married, people use nicknames, and the reality is that individuals often talk about how hard it is to learn new names or to use pronouns, but we do this all the time for cisgender individuals and we don't think about it. But oftentimes when trans or gender nonconforming students ask, there's sometimes antagonism or hesitancy to do so. Something that comes up with CRC staff is that you might see school records that don't match the names that individuals have in use. You might see pronouns that individuals don't have in use, and it's really important that we keep those things confidential as much as possible, and that where possible, we're using individuals' names that they use. It's important to note that these names and pronouns aren't preferred pronouns and a preferred name, that these are the pronouns that people actually use and identify with. My identity certainly isn't a preference. It's something that should be respected. So I understand too that like in order to register certain students, you'll have to use certain legal names, and it is important to kind of negotiate with that with students on a case-by-case basis, but to make sure that you're working with your trans and gender nonconforming students to avoid kind of revealing information that they don't want revealed out. I just want to talk about some opportunities for solidarity here with misgendering and dead naming. The first is to never make assumptions. Just never assume that someone is or is not trans. Always assume that always assume that asking for pronouns is useful and those kinds of things, because the key is that we have to normalize pronoun use among cisgender members and staff. In trans communities, we're often used to using our pronouns. We're often used to asking for pronouns or being asked for our pronouns in some cases. But really, the onus should be on our cisgender members and staff to kind of help out and make sure that we're doing things like using pronouns on our staff name tags or email signatures or Zoom display names, as we all have now. Um, this could also include always using your pronouns when you introduce yourself to others. So like, my name is Dharma, use she, her pronouns when you're introducing yourself to colleagues, to CRC members, to other people on campus, visitors, in meetings. There's so many ways that we can include that, not in just a performative way, but really to show that like we understand that cisgender people also have pronouns that they use and prefer. Sometimes what happens during like pronoun circles, like I think it's really great to do pronoun circles during like staff meetings and small check-ins, recovery meetings, because it gets everyone on the same ground of like what name is someone using. Because also we need to check in from time to time to make sure that we have things right, because things do change. And so like I like that idea of going around, except some people sometimes look at it antagonistically and they'll be like, well, I just use male pronouns. And so from my perspective, I'm like, well, what does male pronouns mean? Or oftentimes what I get back from other students, and I don't work at Art My CRC, I'm just a member, but I'll go in and I'll say, I'll use my pronouns, and people are like, I don't care what you call me, but they do care what you call them. And so oftentimes the unfortunate reality is that this is treated as something that's not important, or something that's antagonized. And it's really important that we look to pronoun use and name use as really an important part of cultural respect. And this really does have some intersections with other things too, such as the white supremacist view that we shouldn't pronounce names of color correctly. And these things can kind of be compounded when we're thinking about queer and trans people of color, or trans and gender non-conforming people of color. But I digress. The next thing I want to talk about is just confidentiality as well. It's really important that if you know somebody's former name or name they're no longer using, or if you know somebody used to use different names or pronouns, it's not your place to reveal that information. That information should be considered confidential. Sometimes individuals might not be out as trans, or they might not even be perceived as trans, and their safety might hinge on actually being able to not be identified as trans. And so sometimes revealing that information could out them as well. So I often in trainings and stuff get this feedback like, wow, it's really hard for me to think about using maybe gender neutral language or not using gendered language. And I think a big part of this comes from the fact that we don't kind of think about how much we use gendered terminology. So for folks that really want a strategy, this is something that I found has been successful for folks, especially folks that maybe have like students or children whose like names or pronouns have changed, but is to try a full day or week of fully gender neutral language. So i.e. only non-gender terms like folks or people, or neutral pronouns like they, them, or people's names, and really try to keep track of your struggles, keep track of when you think about it, keep tracks of slip ups, or just how often you notice it comes up. And really note that it's okay to make mistakes, but it's not okay to make our mistakes into spectacles. So sometimes someone will go on, for a couple minutes about trying to apologize, and it'll make it to this big thing, and it becomes more uncomfortable than the initial instance of misgendering as well. And so when you do this kind of one-day challenge too, what you see is it happens so much that you're going to realize that it's really not worth making it a spectacle. It unfortunately, that doesn't remove how negative it is, because it happens all the time, right? Microaggressions add up in the lives of marginalized people. But once we can kind of start to understand how imbricated gendered language is in our day-to-day lives, then we can start to unpack like why we use certain terms or how often we're using them. Does anyone have questions? Feel free to drop questions about misgendering or dead naming in the chat. So these next parts I want to talk about are just some specific issues in gender recovery. So how gendering happens in collegiate recovery. Some of the topics I'm going to cover include gendered meetings, sponsorship, literature and readings, and then some housing and facilities issues. So the first thing I want to talk about is meeting formats and recovery literature. So the first thing I want to talk about is meeting formats. Gender-specific meetings are really important in recovery. Um, as we understand, sometimes things like women's meetings, men's meetings, these are really affirming for individuals who might want to have solidarity and community with individuals who share their gender identity, and talk about issues in recovery that are maybe specific to their gendered experiences. These gender specific meetings are important, however, they should be inclusive, i.e. all women's meetings should include all women, not just cisgender women, but trans women as well. Um, and the same would go for other binary meetings. Ultimately though, oftentimes what happens though is that even if they have these meetings and they are inclusionary, they're still not very representative of maybe trans and gender nonconforming experiences. I don't know how many times I've been told principles before personalities when trying to bring up specific trans specific issues in recovery meetings, and these are generally 12-step meetings. And so I think it's really important to, one, offer 12-step alternatives at your CRC, making sure that we're using ones that aren't maybe Christian language based, that aren't, that don't use gendered language, and those kinds of things, or maybe that aren't gender specific. And then maybe considering offering trans and gender nonconforming specific meetings, offering meetings for trans and gender nonconforming students in recovery. This could be an open format. This could be a trans NA meeting, something, but really making sure that you're offering a trans or gender nonconforming specific meeting can be very helpful. Of note, what I was talking about before is this kind of difference between LGBTQ and trans and gender nonconforming. And so consider breaking up LGBT meetings into LGBTQ and trans and gender nonconforming meetings can be helpful. It also speaks to the understanding that sexuality is different than your gender identity. And so sometimes just having an LGBTQ plus meeting, while helpful, especially if you have smaller campuses and maybe can't facilitate both groups, it is often helpful to break those up. And then something I talked about before was just adding pronouns and name circles to CRC meetings. Even if you think everyone is cis, it's important to do this. Sometimes the thing is that, like, I've noticed that at my CRC, sometimes they'll only ask it when they know that trans students are at the meeting that week. And that's really antagonistic, because what if there's a newcomer? What if someone's not out? There's a litany of things, but just making sure that we keep those things as part of our formats. Yeah, and so in thinking about it too, a lot of the time what comes up is people's pushback on, like, we don't have a lot of funding, we can't do those kinds of meetings. And so an alternative also is to is to find LGBTQ plus specific meetings that are happening around your community and offering to have them in your space. Like at our CRC, for instance, we offer community organizations to host meetings in our space as well. And so sometimes you might not be, or your CRC might not be the best to facilitate that. Maybe you don't have the resources, maybe you're just not sure, maybe you feel uncomfortable, but maybe partnering with a group who's doing trans inclusive meetings around town and bringing those into your CRC or CRP can be a good way to fill that gap as well. The next thing I wanted to talk about was literature. So, and the pamphlets and resources that we have kicking around CRCs. So just an example from NA, I pulled just their basic meeting readings that I've seen. And all of these have, in these few readings, so who's an addict, why are we here, we do recovery, how it works, the 12 steps and the 12 traditions, there's at least, I think there's 11 or 12 cases of unnecessary gendering. These include gender pronouns in steps, reference to gendered deities, reference to gendered partner terms like wives and husbands. And the reality is that if I go to 3 meetings a day, I'm going to have to hear 30 something unnecessary gendered terms. And if you can imagine how angry and volatile and hurt we all were in early recovery, Imagine also doing that while you're a trans or gender non-conforming student and constantly having to deal with gendered pronouns, particularly if you don't use gendered pronouns, if you use gender neutral pronouns, or if you're a non-binary person. These things can be especially harrowing. And we want our students to be as successful as they can in recovery. And I think it's important to look at the formats that we have, look at the groups that are hosting groups, and try to ask them if they can change things. Oftentimes the problem is in some 12-step groups and groups that have been around for longer is they have hesitancy to change things like formats or literature. And so making sure that we're offering alternatives that don't use gendered literature and pamphlets, and maybe making sure to, like, I remember um I was at when I was in treatment, we went out to a meeting once, and I went to go look at their pamphlets, and I wanted to look at what their like LGBTQ plus pamphlets were. And the only LGBTQ plus pamphlets they had were like covered in coffee, and they were old, and there was literal spider webs covering that part of the little like rack for the pamphlets. And that's like what it feels like looking for this kind of literature often, is it's that old coffee stained one that's maybe under the coffee maker at the meetings. It's stained, people put their mugs on it, you know, but that's really how it feels. It's really hard to find them. And when it's there, it's maybe not the best. And so maybe looking at, well, who's represented in your handouts, what kinds of handouts you have, maybe looking at the posters and things around your CRC and looking at the resources, look who is represented there and maybe who isn't. The next thing I want to talk about is some dynamics of gendered fellowship. So, and this is specific to maybe some 12-step programs, but I know that these kinds of ideas aren't just specific to 12-step programs, and they often get pulled into the wider kinds of ways, cultural ways that we have in recovery. So the first is cisnormativity and heteronormativity, which just mean like, essentially these ideas of normativity just mean like expectancy. So expecting everybody to be cis is normativity, or heteronormativity, designing a program in mind, for instance, for only straight couples is heteronormativity. That's a really quick definition. If folks have questions about that, please drop it in the Q&A. But ways that these kinds of normativities come up in sponsorship and fellowship are like the idea that only men can sponsor men, or women can sponsor women. Like, who sponsors non-binary folks is often a really good question. I know in my local community, there's not a lot of non-binary sponsors, and that can be really hard. A problem isn't that even just that these don't, that there might not be people that are being identified in the community as being able to sponsor non-binary people, but the fact that sometimes we will tell trans or gender non-conforming students, well, why don't you go talk to your sponsor, when there might not be anybody able to sponsor them or willing to sponsor them in the area. And oftentimes this comes because of gendered newcomer rules, where individuals won't approach people or talk to people in early recovery if they perceive that individual as being a different gender than themselves. I know something that's really harrowing every time I've gone into a meeting as a newcomer is getting a phone list. And that's often because I get a men's phone list. They don't even ask, right? And I've gone into a meeting in full drag after a drag show and gotten a men's list. And so it just goes to show you that there's maybe not this kind of gendered care or nuance in how we approach newcomers sometimes. And so that we might think like, oh, we're doing a really good thing by making sure this person gets a phone list, we're going to hook them up with all the other people. But the problem is that by not asking that individual, or by unnecessarily gendering our phone lists, we might be kind of reaffirming notions of both cisnormativity and heteronormativity, right? So oftentimes the ideas that we shouldn't, that we should kind of have gender segregation in recovery is because of the idea that people won't be able to sexually control themselves, which is one really disgusting notion that's kind of steeped in like misogyny and rape culture, but also seeks to reaffirm that everybody is cisgender and that everybody is heterosexual. Another thing is that like, what alternative recovery supports exist? So think about this, like some folks will sponsor folks of different genders. And it's maybe really looking in your communities and helping your trans and gender nonconforming students as well to find inclusive sponsors, and maybe thinking about that sponsorship as temporary as well can be helpful. Because I know that for me, it's often been harrowing to think about like, oh, well, there's only cis folks here, but oh, there might be a really rad cis woman who's down to sponsor me. But I think ultimately for some people, they will want people who share identities that are closer to their own. And that is valid. And so sometimes it's a matter of helping our trans and gender nonconforming students approach sponsorship through temporary ways, so that they can be supported while they find someone in a wider community. Um, so just really think about what alternative recovery supports exist. Think about trans inclusive groups that are happening around your community, and maybe thinking, especially if you're a CRC staff member, to get involved, connected with them, so that if these issues do come up, or if these kinds of obstacles come up, that you can be in solidarity and really have some solutions instead of um, maybe just seeing the problem. Excuse me. So this next thing I want to talk about here is housing and CRC facilities. So for CRCs, this is basically for CRCs that have more of an actual building. Some of these considerations can be maybe drawn into like advocacy in your campus buildings if you don't actually have a CRC building or a CRC dorm, like a student dorm. Or these can be applied alternatively to like sober housing units and things like that that maybe aren't CRCs specifically. But I digress. So for CRCs that are with student housing or considering adding student housing, um, first thing that comes up for me is binary housing. So binary rooms, floors, such as male floors, male only, female only, or male and female only. Rooms and floors exclude non-binary, intersex, and other folks. I didn't define intersex before, but intersex refers to individuals who have um, physical genitalia that is considered ambiguous by cisnormative standards of like the length of external genitalia. And they can have any mix of primary or secondary sex characteristics. But the but to get back to the point was that these floors, if you only have them designed for men and women, they may only include men and women. So some considerations is to have gender inclusive housing policies. So for male and female trans folks, that means if you have male or female housing, that also includes, again, all males and all females. So including trans women and trans men in gendered housing is important. But also maybe having gender neutral or co-ed rooms or floors can be an alternative as well. I know that in my CRC, it's been really successful. We just have co-ed housing, gender neutral housing. And oftentimes the thing is that CRCs are smaller than other housing units. You're less likely to expect a lot of students. And so making your CRC gender neutral housing can actually increase your ability to house more students and help more students thrive in recovery. Another issue is restrooms. So what's the point of being able to go to the CRC if you can't actually go to the restroom at your CRC or in the building that your CRC is housed at? Right? So think about like converting any single use restrooms that are in your facilities to gender neutral, and advocating for campus policies that protect the rights of trans and gender nonconforming students to use facilities that align with their gender identity. There's no other way to go about it than just including trans students and being able to use the restrooms that match their identities. This is the safest thing to do for students. It hasn't been shown to expose other students to harm in any sort of way. There's a lot of like scare science out there and falsehood that seeks to kind of criminalize transgender people or make us out to be sexual predators just when we're trying to use the restroom. I know I've had these issues in recovery spaces. And it's really important that we kind of just affirm not only that students, that our members can use restrooms that align their identities, but that we're advocating for campus policies that include our trans and gender nonconforming students as well. We should look to gender neutral design as a component of universal design for access. So if you have an ADA accessible room in your campus, in your housing facility, it should also be gender neutral. Like there's no reason if you have those limited ADA resources too on campuses, like a limited amount of accessible rooms, they should also be gender neutral. Understanding that like disability has higher, or that like trans people have a higher rate of impairment and disability compared to cisgender peers, but also just understanding that when we design gender neutrally, that it's just more inclusive to begin with. So if you're building new restrooms or new facilities, make sure they're built as and designed as gender neutral facilities, for instance. Um, and these can be really helpful. Looking to like gender neutral locker room design, or like single use, like changing stalls that are separate from shower stalls, single use shower stalls. There's a lot of different ways to approach that, and I would just explore with like university housing, if you're able to kind of inform that process, to really advocate for design of locker rooms, things like that, that are either including extra options for non-binary folks or gender neutral um, altogether. The last thing here I want to talk about is confidentiality. So it's really important that privacy can be a safety risk, primary safety risk for the lives and well-being of trans and gender nonconforming students. So I want to talk about what is outing and why does it matter. So outing is the disclosure without consent of an individual's gender identity or sexual orientation. For trans and gender nonconforming students, their status as being trans or gender nonconforming, while they might share that with you as a staff member or as a peer, it's really critical that we respect these individuals' privacy, because they can face discrimination from their institution, from their employer, from other individuals in the recovery community, or from their families. And that might not just mean like social discrimination, that might mean violence, that might mean harm, that might mean losing their job or losing their lives. I know that as a Muslim trans person, I would be very scared if someone told my family members about some of my identities. And um, and and for a lot of individuals, they might have to negotiate being out in different ways, in different places, and in different capacities. And so really just understanding that maybe we there really is a good sense of anonymity maybe in the collegiate recovery community and recovery communities, and maybe just doubling down on that when we think about like um trans and gender nonconforming students and wider LGBTQ plus students more widely also, to make sure that we're protecting their privacy. So I wanted to go over some just quick do's and don'ts that kind of bring together what we talked about before moving on to maybe some how to move forward. So the first do is to ask for pronouns. So always ask for people's pronouns. Um, do apologize for misgendering people or using an incorrect name. Do ask for clarification on how to pronounce names and pronouns if needed. If someone's using pronouns that you're not familiar with, if someone's changed their pronouns, if they're writing it and you don't know how to say it, or if you don't know how to say someone's name, ask. It's really important to ask for clarification before you make mistakes instead of having to apologize later. But then I also wanted to go on to some don'ts. So don't ask about hormones or surgery status. So much of trans and gender nonconforming students' lives are spent pushing away prying questions about hormones and surgery status. And gender nonconforming people's identities are much more than medical transitions. And it's really inappropriate to ever ask a trans person, especially your students or other collegiate recovery members, about their hormones or surgery statuses. And it does happen, it does happen a lot. Another thing is to don't make a scene when trying to apologize. I can't tell you how many 5-10 minute long apologies I've had to cringe through, and really just sometimes we just want to move on. And I do appreciate, and I think it's important to be accountable. But the important thing is to, one, not make that apology about you, and to really make it something that is just acknowledged and move forward. So just, oh, sorry, correct yourself. And correcting yourself should be part of your apology. You shouldn't just apologize when you dead name or misgender someone. You should correct yourself and then apologize and continue. Don't ever ask an individual's dead name or call it their real name. Don't ask, what's your real name? The identities, names, and pronouns individuals give you are real. Don't out or disclose individuals' identities without their consent. And don't pressure people to self-identify as trans if they do not want to. So if you think that someone is trans, want to ask their pronouns, they don't want to give you any information, that's their prerogative as well. So don't pressure people to self-identify as trans if they don't want to. And then further, don't make assumptions about our sexuality based on our gender identity. So this last piece is the 3 A's to inclusion: accountability, alliance building, and actionable measures. So if you want 3 good takeaways from today's webinar, I think these would be it. The first is accountability. So this includes peer and student accountability for discrimination microaggressions. This means keeping yourself accountable for when we make mistakes, and we do inevitably make mistakes, including myself, as far as trans and gender nonconforming inclusion. That also means that we need to keep our peers accountable for instances of discrimination and microaggressions that we see, and keep staff accountable as well. Part of that is creating anonymous or confidential reporting for interpersonal issues at your CRP. I wouldn't want, because as students who are in recovery, we're marginalized because of that status, that shared status. It's sometimes uncomfortable for me to bring interpersonal issues to like the ombudsman on campus, right? Or like or an office on campus that deals with conflict resolution, right? And so making sure that we kind of design internal reporting systems at CRPs for interpersonal conflict, especially interpersonal conflict at the intersection of diversity, equity, and inclusion, is really a great way to foster personal accountability, but also making sure that we're taking care of these things inside of our communities and not maybe having to go outside of our communities for healing. And then community guidelines, having community guidelines for staff and student members. Well, you likely already have guidelines at your CRC or CRP, but making sure to maybe review those, removing instances of gendered language, and then also making sure that you have specific caveats for the inclusion of things like restroom access or trans and gender nonconforming inclusion and respect. The second thing is alliance building. So you might not be the best person to do this work, and that's okay. But it's important that you maybe find people that are equipped to help you do the work. So connect with trans and gender nonconforming groups on your campus. Build pathways between campus cultural centers and organizations and the CRC. And partner with community organizations, because sometimes like this work is really overwhelming. Sometimes we don't know what we're doing. Sometimes it's the first kind of step into inclusion that we're doing, or we might just not be the best person to be doing that work, and we know that through our reflexive understanding of social justice. And so at that point, it's important to also build alliances with other people, because there is people that are doing this work. There's organizations across the country that are doing this work. And your students are certainly finding ways to be successful and thrive. And so I would connect with LGBTQ plus groups across campus, connect with trans groups across campus, or with other service units across campus to see if there's ways that you can connect across groups. For instance, one thing that we did at our campus was connecting our Pride Center with our CRC, so that if individuals present at the Pride Center with a substance use issue, that we've kind of made the introduction between our CRC director and the Pride Center so that they can serve as a liaison, understanding that trans and gender nonconforming students are more likely to seek services, and students of color are also more likely to seek services from cultural resource centers and groups that are geared towards their identities, and not CRCs necessarily, and not student health services. The last part here is actionable measures. So actionable measures basically just means tangible things. It means actually doing something outside of maybe building alliances or accountability, because those things can often seem like more of a conceptual work, or maybe building alliances doesn't seem as tangible. Actionable measures include things like putting out inclusion statements. And it's not just doing these things, right? It's not just making an inclusion statement, but it's actually making a visible inclusion statement that's on your website, that's, you know, visible in your CRC spaces, right? It's looking at visible solidarity and representation. So if your CRC makes media, which they probably do, right? If there's like pictures up, if you're making videos to things to share, if you're making things for donors for your CRC, if you're making ads to recruit new students, or what have you, all of these are opportunities to include trans and gender nonconforming students, and maybe bodies that don't look gender nonconforming or that don't look gender conforming in your media. I know one thing, it's hard. You know, you can say that you're trans inclusionary all day, but if I don't see it sometimes as a trans student or as a person in recovery, I'm going to be hesitant to approach that group. I'm not going to know how safe it is. And so, like, you know, show off your safety, show off your inclusion, and really make sure that there's that visible solidarity. You know, this also includes like being cognizant of groups in your area in the alliance building piece. But if there is a pride, you know, if there's a pride resource fair going on, why not have a table for your CRC? Just an example. And then the last part is program and resource creation. And this is really vital. This is creating those pamphlets that go up in your CRC. This is creating those meetings that I was talking about. And this is really that, like, that meaty work, I guess, of trans inclusion, of actually like building those programs. And so I'm curious, I know it's the Q&A format, but I'm curious if people can maybe drop in the Q&A, what are your experiences with or across these? You know, what is something that's gone poorly or gone helpful or been helpful at your CRC regarding these issues? If you don't have anything in regards to that, maybe just share with me like what you learned today or something that was new for you, something that was challenging for you. And Sylvia or Liv too is open for all of you.
Thank you, Dharma. I'll leave it to others to add any comments first, and please just enter those in the Q&A box, and we'll get to, or the chat box, and we'll get to as many of those as we can.
And I have more materials too, so this is open now for questions and discussion as well. I'm going to leave this last one up, but
we haven't had anything yet. I've just found it particularly helpful. I mean, I'm a big believer in making recovery spaces more inclusive. I've been writing about this for a while. So, you know, I'm really happy to see that we are talking about this more within the collegiate recovery field.
And you're out here on the West Coast, right, Liv?
Yeah, I'm in Oregon too.
And I think that's a big distinction too, is regional differences, is that I think at least in my experience on the West Coast, there's more conversations happening about trans and queer inclusion in recovery spaces than what I've maybe seen in other parts of the country or other, you know, recovery communities. And so I do really think it's dependent on where you're at too, as far as like what conversations are happening.
I completely agree. And I mean, I know Chantal has been doing a lot of work in this area in Virginia, right? It must be so much more challenging over there, because we're so more open on the West Coast. But you know, it's interesting. I still see some areas for improvement in Portland. You know, we could definitely be more inclusive. We don't have a CRC, which I find surprising. Are there any other questions?
Oh, I see one in the Q&A now.
Oh, great.
Do you have a shorter exercise than the 1 day long exercise for using gender neutral pronouns that work in shorter trainings? Yeah, it could be like just for your work day. You can definitely break that down. I think conceptually I've challenged people to do it in a lot of ways, but it definitely has been shorter. The question from Maggie in the Q&A too for folks was that, do you have a shorter exercise than the long 1 day exercise for using gender neutral pronouns that work in shorter trainings. And I think that that really you could break that down into maybe a meeting session. You could also sit and listen in a meeting, in a recovery meeting, not like to break anyone's anonymity, but maybe just like keep track in your head or something of how many times gendered pronoun use comes up during a recovery meeting. And that could give you a sense too of in the context of where this happens. So Maggie, that might be a good alternative, would be to try it during a recovery meeting or during a staff meeting or something like that. And kind of just listening in that way too, might be another way to engage that. Any other questions, feedback, things that have, oh, I see another question. Oh,
Yeah, I just want to say I appreciate the alliance building tip. So I'm a student worker for the CRP at Minneapolis College, and something that I'm really grateful for is that we have like an open format sort of meeting. It's not explicitly 12-step. It's kind of all all walks of recovery are welcome in the meeting, and I really appreciate that. One thing that I think would possibly help is I mean it's a small group. We only have like one meeting a week because I think everything has just been uh, involvement has been sort of decimated by COVID. And so I really appreciate this alliance building concept because I think that could be a way to draw some of those folks that are in probably great isolation right now, trans and gender non-conforming kids and students who are in a lot of pain right now and could really use that sort of recovery space, but may not know that a trans person is leading those meetings and may not know that there is safety in that particular recovery space. So I appreciate that, and it will definitely inform how I continue to do my work in my CRP.
and I think too that like something I didn't touch on was tokenization, and that oftentimes if we don't do, and like for me, I happen to just be, you know, a diverse person who does this work, but for a lot of folks, it's expected that trans people are going to do this work. And we already have to do so much labor as oppressed people, navigating systems of oppression every day, all the time, that oftentimes this labor gets put on the you know, on the shoulders of trans students who are in recovery, who are sometimes in early recovery, and you know, who are navigating also oppressive school systems, oppressive health systems, oppressive relationship systems, you name it. And I think part of the problem too is that like we really need to step up and be in solidarity with these students, especially for those of us that don't identify as trans and gender non-conforming, because we're often just tokenized into doing this work, because if we don't do it, then the work doesn't get done. And that's something that's really disappointing. And I think that part of that comes in not from individuals lack or lack of desire, but I think it comes from more often individuals not feeling empowered. And I think that feeling empowered to do this work is going to be hard when you're not part of that community. But that alliance building piece is really key to kind of sharing that burden. In my recovery has taught me to get help where I can't help. And I think that that's something that like I pull into my social justice activism and inclusion as well. Because like I know I'm not going to be the best person to do this all the time. Um, right, and understanding too that even like things that are designed for trans people can be harmful, right? Right, like not all trans people represent the views of the transgender community, is something that's really important as well. Because you know, for instance, I was giving a training about collegiate recovery, and there's individuals that are trans that don't use that trans like prefix, right? They don't consider themselves trans women, they consider themselves women. And that's an issue that's come up for me before in trainings where um I use these terms for myself like trans woman, and I use them theoretically in talking about things, but understanding too that some people don't want that trans prefix either, right? It's not a focus of their lives. And so for some trans and gender nonconforming students, it's important to recognize that none of this might be an issue for them, and that they might, you know, have needs that are more congruent with what are typically needed in your CRC. And that's important too, right? Yeah. So I'm gonna drop my email in the chat. If people have follow-up questions for me, I love to chat with folks. I'm down to chat about your CRC, your CRP, or other issues, and maybe just be a liaison between y'all and ARAG if folks are interested. Yeah, so I just appreciate that.
Thank you so much, Dharma. And apologies if anyone had any other questions, but do, I didn't see any, but do reach out to Dharma if you do. We hope that that has been helpful and that you'll share this session with colleagues, stay connected with ARHE to learn about future webinars, and let us know how we can improve our offerings. Dharma, thanks again for taking the time to present to our attendees.